Welcome back to Houston Life. May is Stroke Awareness Month, and when it comes to identifying the signs of a stroke, time is of the essence. The quicker you know how to spot the signs of a stroke, the quicker you can get help and the better the outcome. Mel Camp went to Memorial Hermann in Memorial City to learn the basics that could help save a life.
A few years ago, my dad had a stroke, and luckily my brother was with him and was able to get an ambulance and get him to hospital really quickly. Because knowing the signs of a stroke and acting fast make all the difference when it comes to recovery. Today we're at Memorial Hermann and we are going to learn an easy way to identify a stroke, and we're going to go through it in both English and Spanish.
Stroke happens when a blood vessel in the brain gets blocked by a blood clot. And when that happens, the brain cell does not get the oxygen and blood flow that it needs to survive. And we know that for every minute that it goes by that the brain is not getting oxygen and blood flow, 2 million brain cells die. So the quicker that we're able to restore blood flow to the brain, the better chance that we'll be able to minimize the amount of damage that the brain has.
Like Dr. Wu said, 2 millones de células cerebrales mueren por minuto sin recibir oxígeno. Por eso es muy importante actuar rápido.
So the American Heart Association has developed an acronym, BFAST, to help the general public in recognizing stroke symptoms. BFAST is really easy to remember. B is for balance. So when somebody has sudden onset of balance issue and difficulty walking or dizziness, that definitely could be a sign that somebody's having a stroke. So again, you need to act fast when you recognize those symptoms. E stands for eye, so that when somebody has sudden onset of vision issues, double vision, loss of vision, or one part of the vision, you're able to not see parts of your vision. But that's another reason why somebody may be having a stroke. F is for face. Oftentimes we recognize when somebody's having a stroke is when they have a facial droop, so one side of their face is crooked. When we ask somebody to smile, that's another sign that somebody may be having stroke-like symptoms. And the A stands for arms. And the best way to test for that is to, when we ask somebody to raise up their arms, that one arm is weaker than the other. S stands for speech. So when a patient or your loved one, you notice that they have sudden onset of slurring of speech, difficulty understanding or comprehending speech, if you recognize any of those, T is for time. It's really very important to call 911 or get your loved one to the hospital so that they can seek the attention, the medical attention that they need.
The acronym BFAST is the equivalent to Rápido in Español, and it was created to raise awareness in the Spanish-speaking community regarding stroke symptoms and to act fast. If you experience any of those symptoms that Dr. Wu or I mentioned, please do not wait. Call 911 immediately. What we're seeing is that a lot of people want to wait, hoping that they'll feel better. They'll take a nap, they'll take an aspirin, and then they wake up and they're probably a little bit worse. So please don't wait. The sooner you get to the hospital, the more options you have for treatment.
The best treatment for a stroke is prevention. So living a healthy lifestyle, getting assessments by your primary care doctor to make sure your blood pressure or diabetes or high blood pressure is addressed. Exercising and not smoking, those are all critical pieces to ensuring that you're reducing your risk to as low as possible. God forbid you are going to suffer stroke symptoms, and while you recognize using the BFAST acronym, again, it is very, very important to seek medical attention as fast as possible because our treatments are time dependent. And they're very, very powerful, but they are extremely time dependent.
All right, for more information about preventing or diagnosing a stroke, please visit memorialhermann.org/stroke or call 713-222-2273. And that acronym, BFAST, very, very important.